Most women think about their hair on a daily basis. We never know whether tomorrow we will fret over a bad hair day or enjoy its flowing body and bounce. But our hair is much more than a significant part of how we look. If you aren't paying close attention, you might be missing what your hair is revealing about your health. Changes in your hair's appearance, texture, or thickness can be signs of underlying health conditions. It's important to know whether changes in your hair are due to a health problem, genetics, stress, or malnutrition. Hair loss is a normal part of everyday life. The average person loses around 80 strands of hair each day. But what happens when you begin to shed significant amounts of hair, and you notice that it isn't growing back? Hopefully, we can help you understand many of the reasons for hair loss, but understand that there are so many potential triggers. In such cases, it's important to discuss your hair loss with your doctor or dermatologist. They are trained to pinpoint the exact reason why your strands are falling out, and how to remedy the situation. First, let's discuss how the hair growth cycle works. Earlier we mentioned that you have been losing hair all your life. This is because each hair follicle on our scalp undergoes 3 stages of a life cycle. The first phase is called anagen. This is when your hair is actively growing. This phase can last between 2 to 7 years. During this time period, the hair becomes longer and thicker. After the anagen phase, the hair follicle moves into a short transitional phase called catagen. This is when the hair fiber stops growing. This phase lasts around 3 months. The next phase is called telogen. During telogen, the old hair is pushed up towards the surface of the scalp, it is shed naturally, and replaced with a new emerging anagen phase hair. Each hair follicle is at a different stage at different times, so you probably won't notice much of this type of hair loss. This cycle is repeated throughout our lifetime. It's important to understand that hair loss is a very common problem for men and women. Research shows that about 1 in 3 women will suffer from hair loss or reduced hair volume at some point in their lifetime. So, if you are losing strands, it's important not to overreact. Before we tell you about the different types of hair loss, we are happy to bring these videos to you, and if you are learning anything from watching, please support our channel by giving this video a like, subscribing to our channel, and hitting the notification bell. There are basically 2 types of hair loss: genetic hair loss and reactive hair loss. Genetic hair loss is when there's a chance that you're genetically predisposed to hair thinning. With this type of hair loss, you will notice a gradual, yet progressive reduction in your hair volume. This is because certain hair follicles are sensitive to male hormones, and this sensitivity causes the follicles to shrink, producing slightly finer and shorter hairs with each hair growth cycle. Reactive hair loss is the result of a trigger. This is daily, excessive hair shedding that is not reliant on having a genetic predisposition. It typically occurs as the result of 1 or more health issues such as an internal imbalance, nutritional deficiency, severe stress, crash dieting, or chronic illness. Specifically, we will be revealing 9 common hair loss reasons. Number 1. Hormonal imbalance hair loss. Hormonal imbalances are often the trigger for a multitude of health and beauty issues, everything from adult acne to weight gain. If your hormones are out of whack, the effects could affect any function of the body, and of course, this includes hair growth. Estrogens, or female hormones, help to keep hairs in their growth phase. Androgens, the male hormones, are not very hair-friendly. In fact, they shorten the hair growth cycle. An endocrine disorder can cause such an imbalance as to result in chronic hair loss. Number 2. Stress hair loss. This is not a myth. Stress can literally make your hair fall out. Chronic stress raises androgen levels, which in turn causes hair loss. Stress can also trigger scalp problems such as dandruff, disrupt eating habits, and decrease function in the absorption of nutrients, all of which can have a negative impact on hair growth. Number 3. Iron deficiency. One of the most common causes of hair loss in women is iron deficiency. 40 years of research has revealed that iron deficiency has a much closer link to hair loss than we suspected. This is why it is best to speak to your doctor. She can check for an iron deficiency. A simple blood test can confirm this for proper treatment. Number 4. Hypothyroidism or hyperthyroidism. Your thyroid gland helps to regulate your body's metabolism. Any thyroid imbalance can ultimately affect hair follicles. Number 5. Vitamin B12 deficiency. You can recognize a lack of vitamin B12, as it can leave you feeling tired and low on energy. Vitamin B12 deficiency often causes hair loss, as it can diminish the ability of red blood cells to carry oxygen to your tissues. This is a common occurrence in vegans or vegetarians, as you can only obtain B12 through animal proteins. Number 6. Dramatic weight loss. Excessive hair loss is commonly experienced 6 to 12 weeks after dramatic weight loss. Our hair is incredibly important to us psychologically, but physiologically, it is non-essential. In other words, we can survive without hair. This means that when the body experiences nutritional deficiency, the body will automatically stop sending nutrients to our hair. Number 7. The aging process. If you're about to enter, or you are going through menopause, changes in your body may also affect hair loss, which becomes more prevalent during this time in your life. It's important to remember that as we age, so does our hair. It naturally gets finer, and may appear thinned. Again, hormonal shifts during this time of your life can also account for excessive shedding. Number 8. Traction alopecia. This has become more prevalent in recent years. This is the loss of hair that is caused by repeated and prolonged pulling applied to the follicles through wearing certain hairstyles such as braids, weaves, and long dreadlocks. The pattern of hair loss mirrors where the hair is under the most strain, usually over the edges of the hairline. Number 9. Lupus. Lupus is an autoimmune disease that can cause hair loss. Commonly, the hair loss is patchy and accompanied by lesions on the scalp. Beyond the autoimmune process, some lupus medications also may lead to hair loss. Many other medical conditions can lead to abnormal hair loss, including renal failure, inflammatory bowel disease, liver disease, and diabetes. Skin conditions such as psoriasis and dermatitis can affect the scalp and interfere with hair growth. Infections such as folliculitis and ringworm can also cause temporary hair loss. It is crucial that you consult your doctor regarding your hair loss to determine its exact cause. Let's discuss some things you can do to diminish or decrease your susceptibility to chronic hair loss. Don't ignore the problem. If you notice excessive hair loss for more than 3 months, see your doctor or a dermatologist. Most importantly, try not to panic. This will only cause stress. Remember that most cases of hair loss can be self-eliminating, and hair will start to grow back once any internal imbalance is corrected. Consider your diet. Hair is comprised of protein. An adequate daily intake of protein-rich foods is essential for new hair growth. Typically, you should eat a palm-sized portion of protein at breakfast and lunch each day. Make sure you are getting an adequate amount of complex carbohydrates. This will ensure that your body is providing your hair with the energy it needs to grow. Snack on healthy carbohydrates such as fresh fruit, legumes, or whole wheat crackers. However, if your hair loss is related to something other than diet, changing what you eat will have no effect. Head massage can be more than just pampering. Head and scalp massage can enhance scalp health, as it stimulates blood flow to the area. Natural oils of the scalp and follicles makes the hair stronger from the roots. It's especially effective for anyone who struggles with hair loss due to breakage. Applying natural oils such as coconut, olive, or mustard oil as a pre-wash treatment allows the oil to soak into your hair shaft, making it less vulnerable to breakage when your hair gets wet. Avoiding certain hairstyles. Pinning back the hair in a ponytail may be convenient, but it could be placing stress on your strands. Avoid hairstyles that place tension on the hair and hair follicles. It's also best to refrain from use of heavy styling creams and serums. They can add unnecessary weight to your hair. Graying hair might be a problem for some, but our advice is to avoid harsh chemical treatments during this time. This includes relaxers and hair dye. In conclusion, one product or treatment may not be enough to remedy hair loss. Hopefully, you understand that other things must be taken into consideration, such as your general health, your diet, as well as the condition of your scalp and hair. When dealing with hair loss, try to be patient and do not lose heart. Also, keep in mind that due to the nature of your hair growth cycle, it will take at least 6 weeks before you see any improvement. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. It's important to consult with your physician for medical advice regarding chronic and excessive hair loss, to ensure that you have a clear understanding of your issues from a medical or mental health standpoint. Always consult your doctor or a professional healthcare provider if you have any specific questions about any medical matter. Is there a particular subject you would like to know more about healthy living after 40? Leave us a comment and we'll be happy to put together a video. If you have learned anything from watching, please support our channel by giving this video a like, subscribing to our channel, and hitting the notification bell.